Welcome to the PT on Ice Daily Show. My name is Trissa Hutchinson, Doctor of Occupational Therapy, and today I'm going to talk to you about alcohol and aging, balancing independence with safety. Nothing is more frustrating than when you are working your butt off to help your older adult get stronger, reach their goals, improve their balance, and do all of the things. You're working hard, you're doing all the right interventions, they're working hard in session, but outside of session, you know that they're making some poor choices with alcohol consumption. This is a conversation I've had to manage frequently lately with older adults consuming high amounts of alcohol, and it's impairing their progress or inhibiting their progress towards their goals in therapy. Today, I'm going to share with you three pillars from a systematic review by Bowman et al. In 2022 that talks you through how to provide effective strategies to help reduce problematic alcohol consumption for older adults. Now, these three pillars are aimed at effective strategies for adults in general, 18 years and older. But Bowman et al. Also tried to really emphasize extracting information that was specific to older adults 65 and up. So these three pillars begin with first providing education on health impacts for alcohol consumption. Number two, the benefits of providing social connection and communication support. And number three, providing personalized feedback on an individual's alcohol consumption. So let's dive in. The first pillar, providing an education or information about alcohol effects or the health impacts of consumption of alcohol, especially at a higher rate, is critical. So when we're talking about this, providing education, I want you to remember this the cliche. Knowledge is power. So I want you to start out with the basics when you're talking to your older adults. You're going to let them know what one drink of alcohol actually should be looking like. So that is 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of spirits, or what oftentimes is referred to as like a hard liquor. So just starting with the basics, what actually does one drink of alcohol look like? From there, I want you to encourage them and inform them of what is the recommended guidelines for alcohol consumption ages 65 and older. So in the United States, if an individual is going to consume alcohol, the recommendation is one drink or less per day. That means 7 drinks or less per week if you are going to engage in alcohol consumption. In Canada, they're a little bit more progressive than we are here at the moment. And they actually recommend that for the most positive health benefits, if you're 65 and older, you should be having 0 drinks of alcohol per day, which equates to 0 drinks of alcohol per week. So, to really maximize your health benefits, absolutely just abstaining from alcohol. We're just providing this information. Again, knowledge is power for our older adults. Other things that we're going to do when we're talking to our older adults is explain the changes along the aging process and how that impacts their effects of alcohol. As we age, we metabolize and excrete alcohol at a much, much slower rate. Therefore, our blood alcohol consumption is much higher when drinking the same amount of alcohol as someone who maybe is 20, 30, 40 years younger. This is because oftentimes older adults may have decreased muscle mass in their body and overall decreased water in their body as well. And so, again, they have that higher blood alcohol concentration. Explaining that can be eye opening because some of your older adults may be actually cutting back their alcohol consumption to as compared to themselves when they were much younger, and they may not understand that this is still having a very big role on their overall functioning today. I want you also to make sure that we're providing education on what the negative impacts actually look like. So someone who is consuming alcohol on a routine basis is likely to have a faster rate of decline in their cognition. They are going to have slower reaction time and more issues with driving or poor driving skills. They might have experience with urinary issues because alcohol is a bladder irritant. So if they're experiencing things like incontinence, that might be an issue or in correlation to consumption of alcohol. They might also be having effects of like a sedative effect. So they might be sleepy or feeling less energetic all throughout the day as well. So those are all really important pieces. Then we have this other whole component that we could dive into talking about medications and how medications and alcohol interact together. So many times older adults may be on a medication for something like their blood pressure or pain, or they might be on a medication for something like insomnia or troubles with their sleeping. Those medications are especially harmful when interacting with alcohol. The alcohol or having that high blood alcohol concentration in your blood can really make you feel the or can interact with that medication and can make you feel the side effects of the medication much, much greater. It can make you feel the side effects of alcohol much, much greater, and it will reduce the efficacy of that medication. So the medication is not able to do what it is supposed to be doing to help your older adult. So knowledge is power. Providing them this information, providing them the basics, what the recommended guidelines are, and then the negative health impacts can be huge. I know I'm working with someone who they were referred to me for balance issues, pain, and sleep challenges, and they were consuming a really high amount of alcohol. And so when I just gave them this knowledge, it was a light bulb moment for them, realizing that they were actually contributing to their issues, contributing to their problems, even though they were coming to therapy and working really hard. They were going home and essentially kind of working straight against what they were working hard in therapy for by consuming alcohol. So that's pillar one. Knowledge is power, providing education on the health impacts of alcohol consumption. Number two, our next pillar is providing social support or getting your older adult set up with some sort of community where they can talk about healthy habits and they can talk about abstaining from or problematic challenges with alcohol consumption. Now, this is where we get to be hope dealers. We know that helping our older adults get set up with some sort of a healthy community, a group to participate in. Maybe it's a fitness class, maybe it's a wellness group, maybe it's a circle, whatever it may be, some sort of community where they feel support and can communicate with other individuals or form relationships can help reduce alcohol consumption because they feel supported. It is very common that older adults turn to alcohol because they have A, more time on their hands, B, because they start to self-isolate or they feel isolated. They have less structure throughout their day. They might feel lonely. They may have lost a spouse, or they are starting to feel a loss of sense of purpose because they don't have like a job to go to or a task that they need to attend, or maybe someone's not depending on them anymore like they were in their younger years. So building community support, being that hope dealer, having recommendations for them of where they can go and who they can connect with can be huge in terms of reducing overall alcohol consumption for your older adults. Pillar number three is providing individualized or personalized feedback on an individual's overall alcohol consumption. Now, this is where I have had the most success when working with older adults who are over consuming alcohol. I ask them to track their alcohol consumption. I will give them a week long calendar or tracking form. I ask them to please actually measure how much alcohol they're drinking, write down what they're drinking, when they're drinking, and then they come back to me in a week. I ask them just your normal habits and bring it back to me, and then we review it together. My most recent patient that I had do this brought the form back to me, and we discovered that he was drinking 24 drinks per week. He was seeing me for issues with balance and pain and starting to feel like he is having cognitive decline. When we looked at this form together, and I actually tallied it up because he was just writing things down, thinking nothing of it, but didn't actually total. I shared with him that he was having 24 drinks per week. And what was eye opening to him was when I shared norms for other individuals his age. So 77% of older adults, 65 and older, have on average 1 to 2 drinks per week. 77% are having 1 to 2 per week. There are 15% or 16% rather that are having 3 to 4 per week. There are only 6% of older adults that are having 5, 6 plus drinks per week. So sharing those norms in terms of what he was consuming compared to what the standard older adult was consuming was very, very eye opening for him. And he realized, man, maybe I need to make a change. Giving him that individualized feedback helped him with just understanding his habits. From there, we dove further and we looked into his medications and we realized he's on a pain medication, he's on a blood pressure medication, and he was on a benzodiazepine as well for insomnia. So he was on three medications that all have extremely negative consequences or impacts when also drinking alcohol. So we talked about the consequences, providing him more education, going back to pillar one, but personalize it to his exact scenario to help him have or gain a better understanding. Now, we didn't just stop there. I didn't just try to make him feel bad or scared. Rather, we talked about how we can honor his independence while also balancing safety. So we provide, different opportunities for changes in habits. So maybe we can suggest things like alternating drinks, having one alcoholic drink and then having a glass of water, or waiting an hour before you have a second alcoholic drink. We recommended that he always, if he's going to have alcohol, he's going to have that with a meal to help with some of that blood alcohol concentration. That also helped him with his overall fullness. And so he wasn't having one drink after another, frequently having about 3 to 4 drinks per night, back to back to back. Rather, he was having alcohol and then he would eat and with his meal and then he would have a glass of water. And then what we noticed over time was that his overall alcohol consumption decreased by just implementing some of these habits. Our goal is not to scare people, it's to provide them with knowledge, honor their choice, but try to help them, guide them to choosing a better lifestyle decision or help make a better lifestyle decision. So, in all, we know that there are a lot of negative health impacts from high alcohol consumption, especially when our older adults are aging, they're 65 plus, they're having issues with balance, with cognition, all of the things. They're on different medications. But in general, we are trying to honor their choice. If they want to go to happy hour at the assisted living facility, we're going to honor that, but we're going to provide them with education, information, social support, and overall personalized feedback so that they can make a good decision following or during that activity. In all, we have three pillars from our systematic review from Bowman et al. In 2022. Number one, you're going to make sure that your patients have their information. They know what the negative and health impacts are for alcohol. You're then going to make sure that they have some sort of community or social support. And you're going to provide personalized feedback. You're going to ask them to track their alcohol and you're going to dive into the nitty gritties with them so they can make good choices for themselves. Thanks so much. And I hope that this makes a big difference in working towards your goals with your patients.